This is the Fixer Punk Podcast. I'm Grayson Peltier. Just as promised on the last episode, I am coming back with a Advocacy Notes episode discussing the topic of dealing with the healthcare system and dealing with a health crisis or situation. We've had a few people in the family that have gone through some rather serious stuff, and I've been luckily able to help out with advocating and organizing some of those affairs in a more optimal way. And I'd like you to learn some of the lessons that I've learned so that you don't have to struggle as much in dealing with it, because it is sadly an art and a science of things that you have to get right in order to actually get better. This stuff does not happen on its own. Even if you have really good doctors, if you have great help, great staff, even then stuff gets thrown by the wayside and your needs or your loved one's needs may not get attended to as timely as they could if you had used some additional strategies to move things along better. I do have a separate episode that I did a while ago on insurance grievances. I'll briefly touch on that here, but the first tip that I want to give is if you're going into a new or even an existing doctor with new test results or with test results you want to bring in or any sort of records, is to send copies of everything ahead of time. You don't want to be in the situation where you're having to, in the minutes before a virtual visit, throw something through an online portal. And you're probably going to need to have a fax. If you're dealing with a lot of different medical providers, a lot of them will not have a place on their patient portal or have a way to submit documents electronically. So you want to have access to a fax. There's a service called eFax that you can use. It's like $16 a month. It might be overkill if you're not dealing with a lot of these types of things. There's also a website called faxzero.com. But because of patient privacy laws, a lot of medical providers won't take stuff over email, so you need to be prepared for that. And if you can, send it by fax. If you know, or you and a bunch of family members want to pool together and you know you're going to be dealing with the medical system a lot, to have a fax number, then get yourself an eFax so you have ample room to send stuff out, because the faxzero.com is free, but it has a lot of limits. And then if you want to go over that, then they charge you per fax as well. So you want to send everything ahead of time, and you want to check ahead of time that they've been received. You want to make a phone call, make sure that it is actually in their possession, because I've sent stuff by email before and it's not there. And if you're relying on another provider to send stuff over to another provider, that is its own mess and its own set of problems. It can be good, it can work well, especially if you're dealing with like within the same hospital system or the same medical group and they can all access the same records, and that makes things a lot easier. But you want to check and see that they have received it from the other provider. Otherwise, what you want to do is you want to have those records in hand. You want to have them printed out and you want to send those ahead of time so you're not relying on somebody else. And that's why it may also be good to have a fax number to receive things at, because you can just call them up instead of telling them, okay, fax it over to this other office that may get lost, fax it over to me, and then I'll fax it over to them. So that in any event, you have a physical copy of those records in your hands. And if they tell you that they can't send it over or you need authorization, you need to be ready to have a way to send back a form as well to approve it, because you do have a right generally to get copies of those records. And when it comes to having things printed out, it's not just records. If you're getting testing done, lab testing, radiology, even if they're sending it electronically, you do want to keep a physical copy of those orders and you want to review them. I actually discussed this on the TikTok at FixerPunk a while ago, where there was a mistake made on one of my family members' radiology order, and they were gonna actually scan the wrong leg, and we didn't realize that until we got there. So you want to read those over, check those over, make sure that everything is in fact correct, and you want to have a copy of it and bring it with you when you're going to a radiology appointment or a lab appointment, even if they say they faxed it, because it seems like stuff gets lost or if it's been sent electronically. Again, there may be a small exception to this if it's the same like hospital and they're like, okay, we can't give you that because it's already been sent over. But just confirm with the office that you're going to that they actually have it. And then the next thing is to mind your timing overall, because things always will take longer than they should when it comes to dealing with healthcare. This isn't something that's going to happen fast or like any other type of consumer service. And in general, you have a little bit less of a leverage and you have a bit less of a power dynamic in your favor as a consumer and more in their favor in a healthcare setting than you would in another consumer setting. Especially when you're dealing with insurances that need that require an authorization. That is going to take time. That can take a while. So you want to request things ahead of time. You want to request that if you need authorizations from insurance, make sure that those are all in line. If there's some sort of surgery going on, make sure that everything is in network and approved beforehand, and you get your aftercare and all of that approved as well. It may be a separate approval process. If there's something that's requiring physical therapy or some sort of rehabilitation, make sure that that is planned out and that you have followed up and checked in on authorizations. If you're being referred somewhere, it probably is worthwhile, if it's been more than a week or two, to call back and check in and make sure that that is going on. And you can check in with the office, but then sometimes if things are going too long, then check in directly with your insurance that the office has submitted the authorization, because sometimes there is like a 2-step process or more like a 3-step process where it goes from the doctor to a back-end staff to the insurance company. So it may have fallen through. Even if your doctor says, oh yeah, I sent it right now, they mean that they sent it to somebody in their back office who may not get to it for a week. So you want to be clear on those timelines. And then on a more micro level, when it comes to appointments and timing, know that they'll probably take longer than you expect as well. And if you're being asked to get any sort of testing before an appointment, that is probably going to take a while to come in. And generally, you can trust your doctor's advice on when to go and get those tests and when they're going to get them back, because they do sometimes, for lab work in particular, they do upload into the patient portal that you have a bit later than when the doctor has, and the doctor might get them a few days sooner. But you want to be very, very wary and cautious of anything where the testing is done the same day of the appointment or even the same week of the appointment, because it can screw you up, or even short spacing your appointments in any way. Like, for example, one of my family members had to get an x-ray right before an appointment, and they told her, oh yeah, just show up an hour beforehand to the walk-in x-ray area and they'll get taken care of and sent right up to us. Big mistake. The people there, when we told them, when we walked in, they were very careless. They didn't really care about timing or anything because they were busy, and they wouldn't even tell us how long the wait was. When we tried to ask people questions, they wouldn't answer questions for us. And there was this one particular hospital volunteer that, because we kept asking questions about how long it was going to be, asking them if we were checked in, apparently she got devious and tried to make sure that we didn't get helped, because I guess she found it to be a disturbance to her for us to ask whether or not we were actually in line and how long it was going to take. So just know that there are going to be wrenches like that in the system that are going to go wrong. So if you're being told to get testing same day, you have to make sure, is this done on a walk-in basis? Is this reserved? And get there way ahead of time. And in general, some of these medical facilities have confusing parking structures and stuff like that. It's not like necessarily, if you're used to living in a community where you just have a parking lot right in front of everything, you walk straight in. some of these places have parking structures. You have to go around. So you need to add some extra time in order to account for that. So yeah, walk-in, especially if it's something that's done on a walk-in basis, just know that there are some times that they won't be able to give you an appointment for it. Some facilities just won't give you an appointment. That especially seems to be true for x-rays. But at that point, just know that walk-in means it's going to take way longer than you expect it to. And you want to also really know when that happens. You want to know who to ask and when to ask them. Obviously, this volunteer ran interference for everybody in that whole office to try to prevent us from talking to anybody. So you have to know who the person is that is actually either making the decision or who is relevant to your particular inquiry. Medical professionals, what I've noticed is that if you talk about anything extraneous at all, then they will tune you out. So a doctor actually said when somebody complained about how long they were waiting, and then a mix up on the administrative side, the doctor got a little bit upset. I'm not going to talk to you about administrative issues. I'm not going to talk about anything that went wrong logistically. I can only talk to you about the health issues, or I'm going to hang up this video call, which obviously this doctor was being a bit rough, a bit harsh, but they're all on an extremely, extremely rushed timescale. So customer service is not really a priority when it comes to healthcare. You are in an advocacy situation where you are at a disadvantage. So you have to know exactly the right way to make the ask to the right people at the right time. And this also goes for certain types of medical complaints. You want to make sure that you're asking the right things, giving all the information you need to, but asking the right things of the right doctors or care providers related to that specific problem, and not giving too much extraneous information, but also making sure that they're all filled in on every aspect of your health situation. And now I'm going to talk a little bit more about grievances, which I discussed in the context of billing and those types of issues. But if you're being treated poorly in a medical setting, one of the most powerful tools that you have is to file a grievance. If you've already gone through that step and you know that you talked to the right person, you knew when to ask the question and who to ask that question, and when you got to that person, it just didn't go right, or something went really, really wrong otherwise, then you should file a written grievance with your insurance. They can provide you with a form, the information, the instructions are either in your plan documents or on their website. You can call your insurance's customer service and say, I need to file a grievance about a provider. And this is a powerful strategy, but know that it is somewhat adversarial. So you want to know when to use it. You want to know the right time to use it and what it's going to do for you. And really, anytime you're dealing with the healthcare system, you have to know when you're using a particular tool or a certain method or even a certain line of communication. You have to know exactly why you're doing that thing. But that can be a very powerful tool, and they are generally required to investigate within 30 days if we're talking about an in-network insurance provider. Now, board complaints and stuff like that is a whole different story, one that I thankfully have not had to go down that road. But those generally only another thing of who to ask and when to ask. Boards generally don't get involved in more like customer service issues. They get involved if the actual medical care was really, really poor. Same thing with accreditors, is that if you're being cared for improperly, then you can go to the board that licenses the facility, the accreditor that licenses the facility, or the board that licenses the relevant professionals. But or if something you experienced was like discrimination, and that can also go to Health and Human Services and sometimes to a state agency. Like here in California, we have the Department of Fair Employment and Housing. And they will investigate such matters. If it's like discrimination based on race, based on gender, age, sexual orientation, those types of things are protected in many states. And those are things that you can complain about if you're being mistreated on those grounds. But if somebody is just treating you nasty, doing you dirty, talking back at you, an insurance grievance will usually be your best remedy if you cannot get an internal resolution. And you're talking about an in-network insurance. Because obviously if you have a PPO or you're going out of network, that's your money. You can just take it away. That's the thing, is that PPO gives you more leverage over healthcare providers, because you can just say, I'm walking away. I'm going to somebody else. I'm going to another facility. I'm going to another doctor, because I'm paying you with my cash. But when you're in network, especially if you're an HMO, they know you have no choice but to be there. Or you have very limited choices, or it's more difficult for you to change, which always, even if your HMO makes their provider directory opaque, you can almost always call them and ask them who are the providers in this particular specialty, and they will give you that information. In fact, in many jurisdictions, they may be required to divulge that information. But keep the grievance in the back pocket, but it is a bit adversarial. So if it's somebody you like, if you like your doctor and maybe their staff are just like not so great, it's just a minor inconvenience, then maybe don't file the grievance. So because they can drop you from a practice if you do that. Sometimes you may be protected from retaliation. My understanding is that in many cases legally they can't retaliate for certain types of complaints, but you need to look more detailed into your state and your particular plan's documents. But now let's get to the point. You've done your visit, you've done your procedure, what have you. Everything's gone well, and you're about to be given a prescription. Obviously, you want to, very basic, know all your medications that you're on. And you want to ask questions about your medications ahead of time. If you believe that, oh yeah, this might interact with this or this might interact with that, ask that to your doctor ahead of time when you're there, so you don't have to be at a situation where you're like, I have to take this at night. It's late at night. I have to call a random 24-hour pharmacy to find out if this interacts with my other medication. So ask your doctor and ask your pharmacist at the same time. Ask both, ideally. Pharmacists usually know how to take care of medication interaction stuff, but ask them. And you want to make sure that if you are going to need medication upon discharge from a facility or hospital, make sure that the pharmacy they're sending it to is open at the time you're getting released. And then I've also heard from some other people that if you're dealing with a surgery, that you should make sure that you're going to get appropriate pain relief medications, because some doctors will not give painkillers after surgery. There's some controversy around this to prevent opioid addiction. But if that is important to you, then you may want to ask about that ahead of time. And make sure that you have a plan to get your medications in quickly after being released, because the last thing you want is to be in pain and you don't have medication for it, or to not take the medication you have to on the schedule you need to. So make sure that is planned for ahead of time. In terms of like regular chronic medications that you take regularly, local independent pharmacies that offer free delivery and having it on auto refill from them is a big hack for that. So if you want to then just use a local pharmacy that has, but then of course, if you're talking about something where you're going to need to pick it up after hours, if you're being released on Saturday or Sunday and they're not open, then send it over to the chain pharmacy so you can get it conveniently and quickly. But for like regular managed medications, then your local independent pharmacy may charge just the same price or even less than a chain pharmacy, give you better service, and deliver it to your house for free. And that could be a big benefit for you in making sure that you don't run out of things. So that's an option to look into, but make sure you plan for your medications ahead of time as well. And lastly, more conceptually, you want to think about, throughout this entire process, you want to think about what exactly is the goal of what you're doing. The last thing, again, another thing you don't want to be doing, and a regret that you might wind up having. And this was a big thing back when I went through my head injury back in like 2016, 2017, all the way all that whole time is that you need to keep in mind like what exactly your goal is as you're going to any sort of treatment. And this is especially true for any sort of therapy treatment that's long-term mental health treatment, or even like physical therapy treatment that's over a longer term. What exactly is the goal of this? Is the goal to get rid of is to change a particular marker, to have the disease be completely gone as per an imaging or a lab test? Is it to reduce a specific set of symptoms? Is it to improve functioning in this particular area? Know what that goal is and know if it's that treatment is actually helping that and how long it's expected to take to help that. And if it doesn't come along the way you want, then you have to tell your doctor or your other healthcare providers, look, this isn't working. We had said that if I were to do this, my pain would be reduced by about 50% in about 3 months. It's been 4 months and I am still here. I've been coming here twice a week. It's not helping. Those types of things. Or if you're dealing with like diabetes, you're like, it's been 6 months of this medicine. My A1C is still not under control. Or you have depression and you've been going to a psychotherapist for a year and you're like, I am still depressed. Or even I feel better, but my goal of being able to actually perform well at work is not getting any better. Or you have an injury, you have some sort of injury and you're like, well, my goal in this was to be able to get back to being able to run. And this approach of just telling me to just lay down and just keep waiting and waiting and waiting doesn't seem like the right thing to be able to allow me to do what I want to do. Is it possible? Is it possible for me to be able to get back to that activity level? Can I do that? Is it feasible? And if that goal is feasible, then what do we need to do to get there? Because this current approach of just having me sit around and wait for it to heal, it's gone beyond the time limit that we set before. You said that I'd be healed in a few months, and it's been 2 years or something like that. And just keep that in mind, because you could wind up spinning your wheels very, very easily, and treatment begets treatment. It's just like, okay, so I'm just doing more and more treatment, and it feels like that becomes your life. And then you lose sight of why the heck you're doing all this stuff. And it just winds up being a waste of everybody's time and money. So keep that in mind. But now we're at the point where you've gotten better. Everything's going really, really well for you. And now you get hit with a bill. I have another patient advocacy notes on using grievances for the billing process. But now you're in a situation where you think that you might be getting overcharged, or you have a large bill. You want to keep in mind your plan's deductible, out-of-pocket maximum, and your co-pays and your co-insurance percentages. So the deductible is the amount that you have to pay before the plan pays it, and that may only apply to certain services. Sometimes there'll be an overall deductible, but certain things will be excluded from it, just like regular doctor's visits and stuff like that. You don't have to meet the deductible in certain plans, so you have to read all your documents carefully. Your copay is like a fixed amount of money you're paying for a service after the insurance pays. Co-insurance is a percentage that you pay. And then out-of-pocket maximum. If you have a large bill, this is something you really need to keep in mind, because it could mean that you may actually wind up having to pay nothing for your health care the rest of that year. That's a number that is the maximum amount of money that you can pay, or that you're required to pay for care after your deductible in a year. And it's usually in the multiple thousands of dollars. So one of my family members had a out-of-pocket maximum of $3,500. They met that, and they started to get refund checks from their insurance, thankfully, for paying a little bit over that. But I also encourage them to call their doctor's office and tell them, because they're going to collect the copay at the time of service. Like, you go in to the doctor, they're going to collect the copay right before you go in. So I said, no, what you want to do is take that documentation, scan it in, send it in ahead of time through the portal, and call them and tell them, look, I've met my out-of-pocket maximum. I shouldn't owe anything for this visit. So because you hit that limit, you don't have to pay anything for any of your care for the rest of the year. Certain plans have certain differences in how they calculate this, so it may be one for prescription versus medical. But if you've hit that maximum, then generally you won't have to pay, and you're staying in network, you won't have to pay a dime for anything for the rest of the year. And you can request a refund from your insurance. Sometimes they'll send it to you automatically if you have paid above that amount. So do keep track of your receipts and the amount of money that you're putting out to see if you are hitting that out-of-pocket maximum. Usually they'll send you a letter in the mail that proves it, so you can keep that letter, send it over, keep a copy with you just like you would any of your other documentation, test records or whatever when you go to the appointment, and get things straightened out with billing ahead of time, ideally, because the front office person may not talk to the billing person. So make sure that they all know, yes, this is paid for 100%. The insurance is going to be paying for this 100% because the out-of-pocket maximum is met. Now, there's a lot more we can get into in terms of bills. In certain cases, you can qualify even if you have private insurance. If your income dips below a certain level at some point during your treatment, you can qualify to have Medicaid pick up the entirety of the bill. If you don't have insurance, you want to ask about patient assistance programs from the hospital. You want to ask about those when the first bill comes in or even ahead of time. To have Medicaid pay retroactively, there's a time limit on that too. So if you have no insurance, or if your income has dipped below a certain level per month, a really, really low level per month, at certain points in your care, you want to keep in mind that and know your particular state's rules on adding Medicaid on top of a private insurance to cover that patient responsibility portion of the bill. And then one thing I have also noticed is that in terms of emergency bills, ambulance bills tend to severely overbill. They tend to send out a bill that says, you owe this much money. The insurance has paid us this much money, but they put their sticker price on there, less the amount the insurance paid, and say that you owe that amount of money, the remainder of it. In some cases and certain states, your insurance is required to cover that ambulance as if it was as if it was in network, even if it was out of network, so that you only pay your copay. They can't just charge you the difference between what your insurance paid and their rate. And that is a point where it's a good idea, if you're getting a large bill from an ambulance or an emergency related provider, especially, to file a grievance and state this is an emergency service. It should be covered as in network. Generally, that is the federal law, but some states have stronger protections where you can actually force the insurance to pay them up to that certain level. In some cases, though, it is just that the provider gets to bill what they want. The insurance gets to pay just what they believe is reasonable, rather than what the provider is charging. So if you get those types of bills where let's say your plan says that you're supposed to pay only 20% of an ambulance bill, and you get a bill where it's like 80% of it, or you're supposed to have a $100 copay for an ambulance ride and you get a bill for $1,000, then that is a good time to potentially go and file a grievance before you pay that bill, if you can't just resolve it over the phone with the insurance provider. Sometimes they'll resolve it without filing a grievance, but my experience is that if a bill is severely underpaid and they're not budging, you're going to have to do that so you have a paper trail associated with it, and that's all filed in writing. All right, so hopefully you won't need all of this advice, but if you or a family member is going through some sort of health crisis or an injury or an accident, something like that, where you're responsible for the bills, that may help. And then, of course, all the general advice on how to deal with the healthcare system in a bit more of an efficient way. So I hope you got something out of this. If you have questions for me, if you have any other subjects that you want me to cover, ways to advocate for yourself and deal with the system in a little bit of a better way, then please go ahead and give me a call at 844-477-PUNK. Leave a voicemail message, 844-477-7865. Tell me about any dilemmas that you've had, any systems that are causing you oppression or even just a bit of an annoyance. I have been through so much. I have seen just about everything in every area. I'm not an expert in any of these things, but I have seen a lot of stuff. I've seen a lot of people getting screwed over by a lot of other people, and a lot of people that are getting screwed over sometimes by accident and not getting the best out of this highly complex wave of late-stage capitalism and non-responsive government that we have here in America. All right. Well, thank you so much for taking the time to listen to this today. Please follow the social media at FixerPunk on both TikTok and Instagram. You can also follow at Grayson Nation on Twitter. And I will be putting up content on there. TikTok is probably the most updated with tips, advice, rantings, and updates about things that could affect your life, both politically and personally. And I thank you for your time, and I hope you will join me again for the next episode.